Hello Post viewers. One of the main issues that most patients confront is back pain, and this is mostly because they are engaged in a occasion which involves sitting for a longer period of time. So how should one ensure a healthy spine is what we're going to speak to with Dr. Sudhakaran of Royal Care Hospital. So doctor, most of us are, we have a job which involves sitting over a long period of time. So what does one do to ensure that, the spine is healthy, a good posture? But what exactly, is it possible across the kind of jobs that we are doing?
Yeah, what you talk is something we call it now as ergonomics. We have to maintain the balance of your back just by sitting upright, and most of the people now are into IT professions.
Right.
And most of them are they have changed their lifestyle to a sedentary lifestyle nowadays. So when you're sitting in a chair or doing some work, you should keep your back straight. That means that you have to sit with your legs very parallel to your hip, and you should be sitting just looking at a computer or whatever you see at an angle of around 15 to 30 degree, and your hands should be just 90 degrees onto the armrest where you got. And if you're working on the mouse, you should keep it very comfortable so that you can move, only minimal movements are happening. So these things, if you follow in your lifestyle while sitting in a chair and doing works, I think your back should be okay. And meanwhile, nowadays you can see a lot of upgrades in the chairs. Ergonomic chair.
But all institutions or all organizations do not provide ergonomic chairs, doctor. So what should what should people working there do then?
Yeah, then you should your back should almost touch the back of the support where you are sitting.
Okay.
And you should
in an ordinary chair.
Yeah, in an ordinary chair. You should sit to the last of the chair, and you should be lying with the back on there.
Okay.
You have to work upright, and you should not lean forward. What causes is that when you are leaning forward, the entire weight of your body goes forward and back is dragging you back. So there is always a conflict between the dragging pain. So you'll get a lot of back pain when you're leaning forward and working on the computers. So you should always sit comfortable and keep your computer based upon your back and work on it. That's a better thing to do.
Okay. So doctor, is only the wrong posture one of the main causes for back pain, or are there other causes as well?
Yeah, absolutely. Now we can see the working conditions are changing, and wrong posture is one of the more common thing we are seeing nowadays.
Okay.
Apart from that, we got a lot of other reasons, like I told you, sedentary lifestyle, sitting on a couch on a non-solid like cushion, sofa and everything, where your back is not upright, it will get into the structure of your sofa. And again, traveling for long distance to your workplace, like if you're working around 40 kilometers away from your home, if you're traveling in a bike without any back support every day, like traffic, you'll take like 1.5 hours.
And then you have potholes also.
Yeah, everything will be there.
Roads are bad.
So everything is considered, because those things and all will increase your problem in the back.
Okay.
Not only the sitting place and where you are working. Apart from that, we got something called genetics, gene. So if your father or mother has got some back pain, you are more chance to acquire that.
Okay.
And moreover, if you are very tall, your ligaments are very lax, so that when you are bending and doing some straining activities, you are more prone to get a back pain.
So tall people are more prone?
Yeah, more prone for back pains.
Okay. So doctor, what is the age group of people who suffer from back pain? Is there a specific age group? Do you see pediatric cases? Are elderly cases more? What is the kind of patients you see as far as your practice goes?
So most commonly we see a patients above age of 40 years who tend to get a back pain, and more often a leg pain also, and a numbness or a weakness. But reason for this back pain is not that he will get only at the age of 40. The reason behind that is he may be working a lot, putting his back on strain when he is in a teenage, maybe around 20 to 30 years. He may be working a lot and traveling a lot and bending and doing, like laborers used to do a lot of works. So those things causes black disc to become very bad. So that pain will be exhibited at the age of 40 or 40 plus. So meanwhile, when the progression of the disease happens, the disc prolapse happens following the damage to the disc, which causes the compression on the nerves, and the leg pain happens.
Right.
So back pain we see mostly up the 40, but reason for the back pain starts at the age of 20 itself. So don't think that you will be free of back pain if you are at the 40, but because of what you do work heavily in your 20s, you will be having a back pain in the 40s.
Okay. So doctor, you were talking about compression of the nerve. So what is the kind of treatment that you probably will give if people come with those kind of issues? So you're saying that the problem in the nerve will reflect the legs. So they will get, so this will supplement the back pain, leg pain, or they will have leg pain alone?
That's a good question, like what you asked. Back pain, and that is be followed by the leg pain. I'll tell you that before that we'll go to the anatomy of the spine. So this is you got almost 33 bones in the front of your spine, and you can see here the yellow color thing that is coming out is the nerves. You got a nerve going through the center of your bones, because the bone is made just to preserve the nerves that is going to the legs and to the hands. So it is coming straight away from the brain down. The nerves are supplying the hands, body, and to the legs.
Okay.
So that needs to be preserved. And you can see in between the bones there is a yellowish thing, that is a gelatinous paste like thing, that is called a disc. It makes your back more mobile. So that's the reason it has been there. If it is a single bone, you can't bend forward.
Right.
And
It makes it more flexible.
Yeah, it makes us more flexible. So the upper part of the neck is most flexible one, and middle part where you got a thorax, it's made of a rib cage that preserves your lungs and the heart.
Right.
So it needs to be stiff. We can't have a mobility there.
Right.
And last most important part is the lumbar spine, that is the lower part of the spine, where you got 5 discs in the lumbar spine. Yes, well, 1, 2, 3, 4, 5, which is the most common region where you bend forward and twist your body and everything. So these are the important structures which get damaged, and that's where you got a back pain.
Okay.
So I'll just go through the cross section fastly. So this is the disc where you can see here the outer layer is more tough and fibrous, and center thing is something more pulpy. So it is called pulposus again. So it's a soft rolling structure which gives mobility for you. So what happens once the age goes away, this disc get damaged, and the disc become black. Like I told you, the yellowish thing is getting damaged, and it's getting damaged, and it's coming out through the fibers.
Okay.
So what happens when you're that is a reason where you get a back pain. The progression of the disease, what happens when you're bending forward and lifting any weights or traveling for a long distance, this black color, I mean what you say here is inflamed disc, comes out, protrudes out, and it comes into the canal where you can see here, this is the canal where the nerves are going. So this disc comes and interferes with the nerve root. What happens here, it irritates the nerve root, and as you know that nerve is a very soft structure.
Right.
Once it get irritated, the nerve that is going to the particular level, suppose it's a L4-5 disc, this nerve is getting compressed, this now goes to your legs. So you will get a pain because of this compression. The nerve which is going down is getting inflamed. So you get a pain traveling down to your legs. That's how the back pain is converted into a leg pain.
Okay.
And after that, if the progression is more, the patient doesn't report to you. If a patient controls the back pain and leg pain and he walks further and does the work, this pain, because of irritation of the nerve, what happens, it goes for numbness.
Okay.
So the part of the region where it is supplied become numb.
Okay.
And final part is that the particular muscle supplied by the nerve will become weak. That's where we develop a weakness. So you can see a lot of patients have got weakness of the legs.
Right.
They can't even walk further because of the chronic compressions.
Okay.
So these are the stages where you get each and everything: back pain, leg pain, numbness, followed by the weakness of the muscles.
Okay.
And more interestingly, in Western countries, people used to come to us when the patient develops a leg pain. But unfortunately in India, people used to come to the big hospitals or referring centers only once they develop all this stage 4.
Okay. Yeah.
So that's a place where we find it difficult to do a better intervention for the patients.
Right. So doctor, how safe is spine surgery, and when does one require an endoscopic spine surgery?
Yeah. Like I told you, patient of our country used to come very late for the surgery,
Advanced
and by the
stage.
time it's very difficult to provide the fruitful results for them. That's the reason where we are, like, in 10 years back we used to be failing, like we can't provide better results. But nowadays, with a lot of equipments and precision tools, we are able to give a good results for those patients also.
Okay.
We got a lot of spine surgery options. First is a open surgery, which we used to do for long back. Like we used to open all the muscles, go through and break the bones before we reach the skin, reach the disc. Like we go from posterior, this is the back part of it. We used to make an incision, take away all the muscles. We will break this bone, all the bones here, just to reach the forward surface.
Okay.
It's something like you are going from the back door of your house. Like to reach the pathology here, you are traveling all the way.
So recovery will also be very
it will be like you are damaging a lot
long.
of structure
Right.
which provides stability for your spine.
Right.
So what happens here is that this creates back pain by itself.
Right.
The damages to the back, all the bones causes the pain, and ultimately you will retract the nerve roots to reach the disc here.
Right.
So once you retract the nerve roots, nerve may be under risk also. So what we do in endoscopic spine surgery is that we just go from the side. If we don't go from the side, we don't go from the back, we go from the side like this. We just go through the muscles only. There's just a 3 millimeter of port. Like we'll put a needle into the disc. We'll just put a dye inside and see how much is the leak and how much is the disc prolapsing out from the place, and it will be seen on the image fluoroscopy that it is coming out this much, and we have to take away this much. We'll put a needle followed by a tube that will retract the muscles just like a pencil, and just will go here. It will just reach onto the disc where we need to work. It's something like a surgical strike. You just reach only the place where you want to work. So what happens once you go here?
So it is focused on the area which has a problem.
We go straight away directly there, and we just used to put an endoscope. There is a scope with a camera. We got an opening for our instruments to go inside and take away the disc. We'll grasp the disc and we'll take away the disc.
Okay.
And finally, once you remove all the disc, we'll see the nerves also how it is. You can see through your eyes what the work have been done. Once everything is
on the
clear,
camera.
we come out of this. So one big advantage of this endoscopic spine surgery is that it's a daycare surgery. Patient comes, walks in the morning, we operate, and not even the night. Within 8 hours you can go back. After the procedure, you can go in another 2 or 3 hours. And one more advantage is that we are not using any anesthesia. We don't operate.
Local
that
anesthesia.
All spine surgery needs to be done under general anesthesia, because you can't go near to the nerve once a patient is awake. You just because of pain will cry away. So we don't even use a spinal. We use a local anesthesia. We'll put a small numbing medicine through the tract, and we just reach there. Patient will be awake and aware. He will be speaking to us, "Sir, I am getting a bit of back pain now. Please don't go there." And we will also get a feedback that where I am. If I am sitting, landing on the nerve root, patient will say, "Sir, I am getting a leg pain." So we'll just retreat back and we'll go to the disc. So it's like a constant feedback we get from the patient also. And once the surgery is over, patient can walk in the operation theatre itself, and will confirm us that pain has gone or not. So it's something like we do as a routine. Patient walks and he goes away to the room, and within 1 or 2 hours, once he got all the parameters he can go to the home also. And moreover, the incision of the surgery will be just less than a centimeter, and we don't even take a suture. We call it as a sutureless surgery, and without any anesthesia. It's a big advantage of the endoscopic spine surgery. And the track we take is totally different. It's not a posterior approach where we break all the bones and go. So by this way, we are not providing any pain for the patient. We don't give any injections to the patient. We give only tablets to the patient on the day 1 of surgery, and patient goes home on the same day.
So what is the chances of a relapse, doctor?
It's like similar to what you do in an open surgery. And one more advantage of this surgery is that we don't create any vacuum space where the relapse can happen. You should have an empty space where the disc can come out again. But what we do is that we go from the side and we take away only the 1 millimeter, 2 millimeter of the disc which is protruding outside. So relapse rate is very less when compared to open surgery. And moreover, when patient goes back and lifts any weights, we are afraid that in an open surgery that can again come out, because there is a lot of void behind, because we have taken away bones and everything. But in this surgery where we go through the muscles and do it, there is no any problem in the relapse.
So doctor, this computer assisted navigated spine surgery, is that the new technology now? How does that help?
It's a very latest technology that we have acquired now in our hospital. You know that spine is very precious structure where you are conserving the nerves going to your legs. Moreover, in the upper part you can see the blood vessels going to your brain also. So it's when you are putting a screw or doing some surgeries in the spine, you tend to, if you miss a 1 millimeter here and there, you may land up in some bad areas where you don't want to land. Like you may injure the vessels going to the brain, causing a stroke, or you can injure a nerve, causing a paralysis of the leg. So the surgery needs to be very much accurate. As an open surgeon or any surgeries, it not tend to be accurate. Like you may miss somewhere here and there. Out of, like if you do 1,000 surgeries, you may get some problems, another 10 or 20 surgeries. But advantage of this navigated spine surgery is that it will give 100% precise and accurate way of instrumentation. Like if you put a screw, we used to put it through this pedicle. This is just 4 to 5 millimeter of the pedicle where you put a screw through the bone. So if I miss here, I can damage the nerve.
Correct.
If I miss on the side, I can see aorta or vessels, big vessels going on the sides. You can miss that also. So with the computer navigation, we are able to do accurate surgery. Particularly in computer navigation, what we do is that we used to take a overall 3D spin. I mean the CT scan, intraoperative CT scan of the patient lying down on the operation theater. So we'll get a virtual image of what the patient is having on the screen. So we used to look at the monitor and just we operate, and we use the instruments that will be navigated here. We can see there it's also moving there. And whatever I am doing is something like a video game. Whatever I am doing here will be mimicked there in the screen. So I can go accurately through the place where I want to without missing 1 or 2 millimeter of the distance, and I can put a screws or do a surgery whatever I want. So it makes a surgery more precise, accurate and safe for the patient also.
Okay.
And another advantage is that it will reduce the radiation for the surgeons. And last thing what we use is that we use a neuro monitoring device. That is something like we'll put it to the patient, we'll monitor the nerves. If I am near to the nerve, that will show in the beep that I am near to the nerve and I have to go back.
Okay.
So you got all safety precautions to the surgeries to make the surgery better and effective for the patient.
Okay. Thank you so much for talking to Kowai Post, Doctor. Thank you.
To get instant news updates, like the Kowai Post page. Click on See First to view the news first. Also, in YouTube, subscribe to Kowai Post channel to watch interesting news and videos.